So the next is the challenges in toothbrushing for children with ASD. So for all these reasons, of course, as a dentist, I will definitely talk more on toothbrushings. I know it's a very difficult, challenging, there's a lot of barriers and agony of doing these activities with ASD children. But there's nothing, for me, there's nothing cannot do. It's something that we cannot do. There's always things that we can do. That's my, I believe in that. So I do empower and give awareness to the parents who comes to see me with their children. What are the things that we can do at home and within our own convenient time to at least alleviate their pains and their miseries. So for that reasons, we have to understand first what is actually the problems when we come to ASD children. What is the problems when we want to do brushing? So I usually ask the parents first before we go to the solutions. We have to understand what can they do, what cannot they do. Okay. So the first photos is actually just merely they don't want to open their mouth. Okay, just simply don't want to open their mouth. So how to access the oral cavities? Say they also like to keep their food inside their mouth. Okay, instead of chewing it, directly swallow it. Sometimes they can keep it up to 30 minutes inside their mouth. So this is also not helping in the sense of oral health. Okay. Next one, when we use toothpaste, they started to playing with it instead of actually brushing, and then they started to spitting it out or just play with it and make things more messy, and it's quite tiring. If we have to do activities, I understand, but maybe we can look into this. Okay. So the lower photos is actually cannot gargling. All right, I do understand many of the children's, it's very difficult to gargle sometimes to the extent of adolescents, they still cannot gargle. Okay, photos, the child with the yellow jacket is actually just run away. Whenever you call abang, brushing time, they just run away, never to return. Okay, just simply run away. So if the child is small in size or maybe in a younger age, you can still catch them and then hug them tight and then try to force the toothbrushing. But when they already grows up and become taller than you, bigger than you, this is going to be very, very much of a challenge. Okay, so the lower one is the most common problems that I receive is actually you can put the toothbrush inside, but they started to bite it. So they just bite, just to pull your leg, don't allow you to start brushing. Okay, so this is also a problem. And then spitting, they can all most of them also have a problems with spitting. So this problem spitting, this is actually more concern of a toothpaste, because most of the parents are quite concerned whether to use toothpaste or not to use toothpaste, because when the child cannot spit, most of the parents think that the bigger amount of the toothpaste will be swallowed by the kids, by the children's inside. So this is also one of the things that we can discuss. Okay, and the lower photo is actually just crying and make things difficult, moving around, not putting best behavior, trying to run away from the activities. So I think this is one of the key and main challenges that the parents might face. You can share with me, parents, if there is a parents in the audience, you can share with me later on in the chat box what are actually the problems that you face during the brushing. You might agree with me, or perhaps you can give me a new other problems that you face.